So last week we found out I was pregnant, and it still doesn't feel real yet. It feels like we're living in a dream.
We are super excited to meet our baby in a short 35 weeks.
What? Grandma? Oh my god! What?
Thoughts and dreams they scatter.
Oh my god!
Put them all together, and I can't explain. Well, you make my dreams come true. Well, you make my dreams come true. Well, you make my dreams come true. I woke up in the world I wanted. Sunrise dancing with the morning. In your eyes, I swear I saw it. I woke up in the world I wanted. I woke up in the world you gave me. New horizon in the making. Wish I could bottle love and save this moment. I woke up in the world I wanted. It used to be a dream, but now it's you and me. It used to be a dream, but now it's you.
Sorry, I don't know why I'm crying. I'm so happy. I'm crying.
We got here just in time because it was like we were here like 10 or 15 minutes and then our water broke.
I just sat down.
So crazy. Did they take you to triage, or did they just...
No.
Oh my god, I want that, Lauren. You know, I'm so glad you're here. Can't believe this is happening.
So once this one's gone is when I'm gonna push.
Yeah, but you can't be very
It
long.
smells like it's an hourglass.
We're about to have a baby.
It's so sweet. I hope I can push good.
Oh, you got through all that medicine? Yeah.
What is he at?
+1. Yeah.
Oh my gosh, he's
+1?
So, he's a mover. Yeah. Mover and a shaker.
I felt like he's going to be pretty active.
Wait, so once he's out of 3, he's out? Usually, yeah. Don't look at me. Don't want to. Are you okay?
Yeah.
Are you sure?
Yeah. Just going to sit down for a second.
Yeah. Don't look.
I'm just going to lay down just to make sure that I'm good.
They're bringing you some juice. Yeah, I'm gonna help with that leg. Hold your breath in while you push. Deep breath, hold it in. Oh. Hold and push down.
You're doing great, honey.
You're sitting with this little juice box. You're doing great. Just when you go over here, don't look, okay? One more time if you can. Deep breath. Push, 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 push. Keep going, keep going, keep going. Good, 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 good.
You're amazing.
You're doing really good already. Oh, good. That was really good. Oh, I've been holding my breath. You hold your breath. That's so true.
So special.
I think just let yourself feel every emotion you want to feel.
Yeah, just soak it in.
Mm-hmm. I'm just crying because I'm happy. We gathered that. Ready? Push down right out towards me. Push, got it. Push, got it. Is that good? Not the best. Oh, but it's okay. Should probably like try to get some under. Are you okay?
No, yeah, I'm good.
Okay.
I just want to do it right. Okay, so it's like
You're a pro.
the J is like I'm groaning all the way down. Push, 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 push. One more time. Nice deep Any tips? Oh, just what you did last time was great. Okay. And his head's coning. He'll probably have a cone head, but that's normal. That's what we want. Good job. There you go. Excellent. Just one more time? Yep, one more. Good job. Perfect. Perfect. You got it. Breathe. Breathe. No time. You rocked, Cooper. Really did.
When do you think that you're gonna have a baby?
Started pushing at I think 6:35, yeah.
6:35. Well, you were 2 hours with your first pushing. So that's usually similar to your mom. Okay. Well, then I'm gonna guess 8:35.
8:15.
8:20.
I say 8:10 because you're doing this so much better.
And I say 8:05.
Just like that. That is perfect. You got it. Go, go, go. Excellent.
Lars, you're amazing.
Is that good? That was perfect. That was without me even cheating. You could see his head come down. Oh,
I wish you would just come out with like Josh hair.
Good job. Excellent. Good job.
Oh my gosh, look.
Yeah, so
That is
pretty.
so pretty. This is so fun to have that things on
There, that's your best one yet. Keep it up, keep it up, keep it up. You got it.
So good.
Okay, now breathe.
Oh, you're killing it.
Yes, good job.
Lars,
Cold white for me.
Okay.
Cold. Are you just in heaven right now? What? Like, everyone's skinny. I can't tell if it's the scene or the baby. But it's just like the giddiest room I've ever been in at 10 centimeters. Most people are like, get it out. Seriously. I hate everything. But she's just so like super peaceful, super relaxed.
It's just gone so well. They said the baby was about to come, like, wait, you gotta give you like 5 minutes to drive there.
Beautiful. Good job,
There's a lot of dark hair.
What?
Yeah.
I hope it's curly. That would be so cute.
Dark hair!
Just gonna put white hands. How can I put your words?
Do you want to go?
There you go. Good, Lauren. That's good. Push. Good job, Lauren. Good job.
Oh, there
Nice.
Woo!
Guys, you got this. The next mile. Okay, just relax those legs. Yep. Your chin's all the way to your chest.
When you're ready.
Take a deep breath in.
Breathe.
Ready? Keep going in now. Here we go.
On it. That's it.
That's it. 9. 10. There's one more. So good. Here we go. Big breath. His head's right there. You just keep doing it.
It's right there.
His hair now. So there you go.
Wow, Lauren, you're so close. He's coming so soon. Yes.
Feels like it's still push time again.
Yep.
Breath in. There you go. Push him. Good job, Lauren. Very good. And now go. Second one. Good job. Lauren. So good. Thank you. He's doing great too. Oh, really? Yes. I don't know what will be. This is the fun.
Oh, they're so close to meeting him.
You're
fine.
Perfect.
There you go.
Let's go, Lars. We got
6, 7, 8, 9, 10.
He is right there. Oh, crap.
That was perfect pushing. That was really good.
Lars's hair.
I just want a mirror to see. Okay.
I just don't want to see like any like tearing or anything.
Okay.
Reach down and feel it. The head, you want to feel?
Right there. That's his head right there.
How much is out?
See, he's waiting, he's ready.
Every ounce of energy.
Got it.
His head's out.
Good.
Keep him out. Come on. Good girl. 4, 3. That was such good advice to hold your breath in, because every time you do, it helps. He comes out even further. Yep. Let's get this baby out.
There we go. That's it.
Yes, that's the push. 3, 4, 4, 5. Keep it going, Lauren. 6. That was so good. We gotta keep him out. That was good, Lauren. So good. Okay, let's take a deep breath in. Again, Lauren. Again, we're so close. Here we go. Breath. 2, 3. Perfect.
Man, he is so good.
You can even see him wiggling. Like,
That's good what you're feeling right now. Okay? That's him stretching you.
I've never heard a mom say I love feeling this.
You want to feel how much his head is out now?
One push away from.
So that's where he is. Look at those hair.
that's his hair.
So much hair.
There's no bleeding. There's no tear. There's nothing. It's just perfect. And could not be better right now. You're doing so good. So good.
Yeah, they can do it. Your guys are strong enough. Here he comes, Lauren. Just freeze. He's coming out on his own. Just freeze. Little man.
Just breathe.
He's like, Lauren, grab him. Grab him. There you go. Good job, Mama. Yes, Lauren. Still pulling his hair.
Look at how much of a cold it is. Oh.
Yeah.
No way! I missed it!
A little closer to there. Yeah. Yeah, I don't have the diaper fast enough.
Super healthy. You're so strong. You did it, Lauren. That's all you
Those are chubby cheeks. So cute. So good. The best feeling. So we can feel him. I can't believe it. He knows you are. He knows you.
Hers are more like Lauren's, but more hair than Lauren had.
That's what I could definitely see Okie in it. I see like your brother's in it a lot.
He looks like he has your smile already.
Yeah, he does.
Dang, yours.
Looks like he has me with.
Yeah.
That's what Dr. Gibbs said in the ultrasound.
Are you serious?
Oh yeah, that's what we did. The 36 weeks family search. He has it already.
That's crazy.
I think he has your eyes too. I've never seen that. Just like the squintiness of them.
He did a little pout.
He is gonna get away with anything he wants.
You guys. Can I put a hat on him and then go off?
No, I don't think I put one on the warmer. Yeah, I forgot.
You are good, Grandma.
Oh, me too.
Oh, he's so peaceful. You guys are
You're gonna be so loved. You guessed it right. Yeah. 8:35.
Like, are you kidding? You guessed exactly the time. No, are you serious?
It's like he's almost wants to breastfeed because he keeps looking like
Yeah, those are children fast. But give him a second. He might be more now. He was I know. In there.
Killed it.
His cheeks are adorable.
Yeah.
They're so cute.
That is so cute.
I was like, oh, okay, that little heads.
Yeah.
And then it's just like,
The whole, I know, it's crazy.
Lauren is super. She was so good. It was just such a sweet, happy experience. It was amazing. You'd be bawling your head off.
Yeah, you look.
Yeah, what did you feel?
oh my gosh, I feel like it was just flashbacks to seeing Lions for the first time with David.
Little Chris. He's so cute.
Love you forever from now. And I will hold you like no one's around. Forever from now. Forever from now.
I thought actually guys tried.
He's reaching up for you. That's so cute.
He's so calm with him. All of his arm rolls.
I know.
I know. It gives you a whole new perspective about how much your parents love you.
Oh, I like he loves you so much. Oh my gosh, he's looking at you. How do you feel being a grandma? Oh, Josh. How do you feel being an uncle?
It's so cool.
Oh, you guys.
He's so crazy.
Forever from now. Forever from now. Forever from now. Used to be a dream. Now it's you and me. Used to be a dream. Now it's you and me.
During a vaginal childbirth, the first stage of labor lasts about 12 to 19 hours and starts when your baby settles lower into your pelvis. In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes, and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix, falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which usually lasts from 20 minutes to 2 hours, your cervix is fully dilated to 10 centimeters, and your baby's head has moved beyond the cervical opening into your birth canal. Your doctor or midwife will instruct you to push during your contractions and rest between them. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. When the top of your baby's head appears, or crowns, your doctor may make a small cut, called an episiotomy, to enlarge the vaginal opening. Then, your doctor or midwife will give you instructions on how to push your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily. After your baby is born, his or her umbilical cord will be cut. In stage 3 of labor, which may last 5 to 30 minutes, mild contractions will help push the placenta out of the uterus. During this stage, you and your baby may begin bonding through skin-to-skin contact and breastfeeding.
It's kind of a one-stop shop for everything, all the information that you need about being pregnant and having a baby.
I don't know what I'd do actually if I didn't have BabyCenter.com.
In the first hour of life, most healthy babies will be cleaned and examined right at their mother's bedside. In the hours that follow, many will also visit the hospital nursery for a more detailed health assessment. The first order of business is keeping your baby warm, since newborns don't have good temperature control. Your baby may be placed under a radiant warmer while being cleaned and dried. She won't get a full bath until her temperature stabilizes. Your newborn will be rubbed vigorously as she's cleaned to warm her up and improve blood flow. It's normal for her hands and feet to appear bluish as her circulation is still maturing. Your baby is assessed for skin color, muscle tone, activity level, heart and lung function, and reflexes in the very first and 5th minute of life. This is referred to as an APGAR score. She'll also receive a head-to-toe exam. Babies who have poor skin color, trouble breathing, or decreased muscle tone may be given oxygen. Those who need their airway cleared will receive suctioning to remove mucus and blood from their mouth. Your newborn's umbilical cord, which has been cut, is clamped to prevent bleeding. Though the cord stump looks large and odd, don't worry, it will dry up and fall off within 3 weeks. Your baby may receive a few medications at your bedside: a vitamin K shot for clotting, a hepatitis B vaccine, and an antibiotic ointment for her eyes. Whatever she doesn't get here, she'll get in the nursery. Her head circumference and body length will be measured, and she'll have her first official weigh-in. Your baby's footprints may be taken, and a nurse will put an ID band on you, your partner, and your child as a safety precaution to avoid mix-ups like having her return to the wrong parent in the hospital. Keep in mind, newborn care varies by hospital, and not all babies will receive a bedside exam. Also, babies born with serious medical concerns will skip the bedside care and head straight to the nursery or a neonatal intensive care unit. Once your baby checks out fine, she'll be diapered, swaddled, and placed back in your arms. Before long, you'll be headed home together.
Pleasant day, everyone. I am your clinical instructor, Ma'am Geraldine Aibito, and for today, I'll be discussing on the introduction to maternal and child health nursing. Now, when we talk about maternal and child health nursing, it focuses on the pregnant women all throughout their pregnancy and childbirth, as well as the care of our newborn. So let's proceed with our objectives. So our objective, number one, is that we'll be able to identify the goals and philosophy of maternal and child health nursing. Number two, describe the evolution, the scope, standards, and professional roles for nurses in maternal and child health nursing. And the third one is we'll be able to define common statistical terms used in the field, such as infant and maternal mortality, and also we'll be able to apply knowledge of physical, social, natural, and health sciences and humanities in the practice of nursing. We will also learn how to provide the safe, appropriate, and holistic care to individuals, families, population group, and community utilizing nursing processes. And the last one is that we'll be able to provide safe and appropriate nursing interventions addressing healthcare needs of the at-risk, high-risk, sick clients during childbirth and childbearing years. So let's introduce maternal health child nursing. So as what I have said a while ago, it focuses on the health issues concerning women, children, and families, such as access to recommended prenatal and well child care. So it doesn't mean that it only pertains to one specific area of a mother of the woman, but also it focuses on the holistic, it's an holistic approach. It includes the children and the entire family. And also, it also provides maternal mortality prevention and maternal and child mental health, newborn screening, child immunization, child nutrition, and services. So maternal and child health nursing, it's when we view it, it's in a larger scope. It doesn't only starts when the mother is being pregnant, but it means it's all throughout until the giving of birth, or until the baby comes out, and we'll be providing that services also to our newborn. So it involves the care throughout pregnancy and promotion of health and prevention of our illness to children and family. Now, maternal and child health care is the health service provided to mothers, women, their childbearing age, and children. So the targets for MCH are all women in their reproductive age group, such as 15 to 49 years of age. So children, school age population, and adolescents. So our maternal and child health nursing practice throughout the childbearing or childbearing continuum. So when you say continuum, it's a continuous. So from the start that there's the childbearing age, 15 years old, it's a continuing until you're going to rear the child or help the child grow up. So the provision of nursing care of women from preconception throughout the pregnancy, birth, and the postpartum period. So the provision of nursing care of children from birth through adolescence, and the provision of nursing care to families in all settings. So it focuses on the mother, the newborn, the child, the family, and the entire setup within the community. So it's a continuum, it's a continuous process. So what are our primary goal of maternal and child health nursing. So it's the promotion of optimal family health to ensure cycles of optimal childbearing and child rearing. So when we say optimal, it's in its best, it's maximum, what will benefit most at its highest level, at the highest level. So as what I keep on telling you, that maternal and child doesn't only focus on the mother, but also focuses on the entire family, from the infant going to the children, and so on, to the as we will be producing a healthy community or a healthy family. So from if the mother has his is if the mother is healthy throughout the pregnancy, and then there will be a healthy infant. So if there will be also a healthy infant through the provision of our health teaching, to the provision of care and proper health teachings to these mothers, then we'll be producing a healthy children. So if there is a healthy children, there are also healthy adolescents and healthy adults, until it promotes a cycle. It's a cycle. It's a continuous from childbearing until the child rearing. So therefore, there will be a healthy families, and later on there will be a healthy community. So that is the primary goal of our maternal and child health nursing. So another thing of our goal for our MCH is that to ensure that every expectant and nursing mother maintains good health, learns the art of childcare, has normal delivery, and bears healthy child. So every mother who is about to give birth, one goal of our MCH is that the maintenance of good health. So through our health teaching as a healthcare provider, so um we will learn a lot of this one when we'll have our immersion in the community. So if we are going to meet a family with there's a pregnant mother, then we have to really educate them as part of the goal of our MCH health teaching, so that she could promote a good health. And also we have to learn how to, like, the breastfeeding technique, the art of taking care of their child. And also, if the mother is healthy, then there will be normal delivery, and also there will be there's a healthy child later on. So another thing is that every child, wherever possible, lives and grows up in a family unit with love and security, in healthy surroundings, received adequate nourishment, health supervision, and also efficient medical attention, and is taught the elements of healthy living. That is from Riala to 2000. So as much as possible, there in that every child should grow up in a family unit with a loving and secure setup. Because really, as a teacher, I can really observe that those children who is not being cared well, or from a different sector in the community, if they lack of this love and security, then they are prone to later on become rebellious. But then if we provide a healthy surrounding and a family unit with love and security, then later on it will really help the child build more confident as in all aspect of their lives, not only in the school, but also in their emotional, social, and psychosocial development. So if it will be able to address our goal in the MCH, we can help this community. We can really help the community. And also another goal is that will promotion and maintenance of optimum health of the women in newborn. So as I already embedded this one, the definition of this one a while ago. So let's proceed to the Millennium Developmental Growth Target. So the first one is to reduce maternal and neonatal mortality rate. It means to decrease the causes of death and sickness to our mother, as well as to our neonate or to that infant. So what are the leading causes of this maternal or infant deaths? So number one is our postpartum hemorrhage. Now, one of the great factor of all this leading causes of this maternal and child is that the lack of education of our mothers, especially those who don't have any access to their OB-GYN, there's no prenatal visit. So there's a great chance that there will be an increase in this maternal and child mortality rate. Now, as student nurses, it is our responsibility once again when will encounter patients, especially when we'll have our immersion in the community. We will be meeting a lot of individuals and a lot and families there, and we will also be meeting mothers. So we really have to educate them that they really have to visit their doctors so that there will be throughout their pregnancy they'll become healthy, and as well as to their baby. So another one is our hypertensive disorders of pregnancy. We have the preeclampsia. So one of the best health teaching is we have to educate our mothers regarding on the proper diet and the proper intake. What are their lifestyles that needed to be correct? So we have to really give them health teaching so that they'll be able to understand and know what are the safe ways to all throughout their pregnancy. And the third one is abortion related to complications such as retained products of conception, uterine perforation, bowel, and bladder injury. So abortion related to some of our complications. So if the mother, as what I have said a while ago, the lifestyle of the mother. So we really have to educate them, especially on those teratogenic that causes harm to the baby, to their newborn, so that there will be a prevention of neonatal mortality later on, or further complications both to the mother and the child. So another one is our obstructed labor. So we have the fetal size, the dystocia, and also fetal presentation and position, mother's pelvis, multiple. So these are the factor now, the multiple pregnancy. So fetal size, if the baby is too large for or LGA, we have an LGA, large for gestational age. So there's possible dystocia, and there will be a difficulty in giving birth. So the mother is prone to cesarean section. So if the baby is too much or too large, I mean, if it's too large, so there will be a tendency that the procedure will go on to cesarean section, and most of the factor came from being the mother is diabetic. So gestational diabetes. So those are the further consequences that the baby is too large for the gestational age. And also the fetal presentation, if it's breech presentation, so there will be also sometimes difficulty to deliver the baby. And the mother's pelvis. So if the pelvis is small, or the height of the mother is not short, no, so there will be a tendency that the pelvis is also small, so it's difficult for the baby to come out. And also the multiple pregnancy, sometimes there will be a conjoined twins, that multiple pregnancy, if it is common in the community. So there should be a proper education to this. So if there really an obstruction in the labor, if the mother has a multiple pregnancy, and furthermore, we have also birth defects, preterm birth and low birth weight, and maternal pregnancy complications. So those are the factor of our complications for our maternal and child health nursing. So due to this reason, monitoring and evaluation system in health programs play a crucial role in addressing the issue of maternal, newborn, and child nursing, child health rather, and nutrition. For the Philippines to achieve this MDG, to reduce child mortality and to improve maternal health. So these are the reasons, no, that we really have to monitor and evaluate, and we should have programs in the community to address these issues, because we are not all in the same status, and there are lots of people who there are lot of people in the community that uh they don't know on the process on what they're going to do, and even the proper hygiene. When you have your duty in the community, you will truly see the real setup of the people there, and especially in terms of hygiene and and in proper nutrition. No? So this should be addressed properly. If it is addressed, surely this millennial development will be reached, or we can achieve this one. No, so when you have your immersion later on, so kindly bear in mind when you'll be handling mothers who are pregnant. No, so you help them, you educate them on the proper way on how to take care of their children as well as their health. So we have also our strategic thrust from 2005 to 2010. So it launched and implement the basic obstetric care strategy in coordination with the DOH. We call this BEMOC. It entails the establishment of facilities that provide emergency obstetric care for every 125,000 population and which are located strategically. So we have this BEMOC, or Basic Emergency Obstetric Care. It is in coordination with the DOH. So the DOH trained, there's facilities, and there are trained midwives that will really facilitate our mother. One concern of our those who lives in the far-flung areas, they have less access to our facilities, to the hospital. So we have this BEMOC, or like a maternity clinic that provide cares for our mother, so that they can access in case of emergency. They can go there. They are trained with midwives, trained doctors or nurses there by the Department of Health. So these are the facilities that will help our mother to access our care or health facility, to access our health facilities. So this one is to improve, it improves the quality of prenatal and postnatal care. So, reduce women's exposure to health risks through the institutionalized of responsible parenthood and provision of appropriate healthcare package to all women of reproductive age, especially those who are less than 18 years old and over 35 of age. So, as what we all know, they are on high risk. Those who are less than 18 years old or who give birth younger, and also those who are 35 years old and above. So, at high risk. So women with low education and financial resources, women with unmanaged chronic illness, and women who had just given birth in the last 18 months. So these are to further reduce the risk of this related health, the risk factors for mother. So those who are there's an institutionalized or responsibility of being responsible parent, and also to provide a healthcare packages to all women. So those women, as what we all know, na yung lesser than 18 years old, they are really prone to they are risk there are lots of risk factor now, such as hemorrhage, bleeding, like that, and also for the age of 35 years and above, there are also health-related issues such as gestational diabetes or hypertension, preeclampsia, and one of the primary factor is the financial resources. So there are family that the father is only working, and some of the families set up no work, both the parents. So responsible parenthood is really really important, so that they will be able to understand that they should not give birth, or they should plan their family because they don't have work. So it will really affect the health of the mother as well as the health of the children later on, and even the provision of education to their children. So there are also unmanaged chronic illness, as what I have said a while ago, like hypertensive. The mother is already hypertensive and then still continuous one during pregnancy. So later on, there will be a high risk for them, as well as to those children, to those mother 18 years old and above. So LGUs and NGOs and other stakeholders must advocate for health through resource generation and allocation for health services to be provided for the mother and the unborn. So in coordination, not only with our local government unit, but also for our non-government organization. So there are organizations that help that helps our community, specifically to address our maternal and child health nursing. So the advocacy to generate resources and to make it accessible for them. So some of our local government units or our NDPs, we have the nurses, the NDPs also, they are being assigned to the different community or communities so that be able to reach all the people in the community, those who lives in the far-flung area, to access our healthcare. So it won't be difficult for them, such as immunization. So there are trained doctors and nurses who are deployed by our LGU or by the Department of Health to also help the community in regards to maternal and child health nursing. Maternal, newborn, and child health and nutrition strategy of the So every pregnancy is wanted, planned, supported, and managed. So that's one of the primary objective. No, so you cannot have a baby if it's unplanned, because especially those people who are financially unstable. So every pregnancy, it is planned, it is wanted, it is not by accident, so that they'll be able to be supported and they can manage it later on. So in every delivery is facility based and managed by skilled birth attendants or HCPs. So before we have this manghihilot, so this manghihilot, they assist, no? Sila yung nag-a-assist during the pregnancy, especially at home. So before yan. And now, because as the days goes by, there are a lot of complications na. So that is why we have this BEMOC, and there are facility based, so that the mother or the pregnant woman can go there and can visit the health center for a prenatal visit. And it should be assessed and managed by the skilled birth attendant. Hindi lang si manghihilot. But there are also manghihilot ang magbigay ng birth sa ating mga mother. So that is one of the primary strategy of our DOH, of the DOH rather. And also the third one is healthcare package for women and survival package for newborn. So hindi lang yung mother, it both ways, makasurvive talaga ang ating mother at saka ang ating newborn. So that is the primary goal of our strategy of the Department of Health. Now, in the maternal and neonatal child health and nutrition strategy, it applies specific policies and actions for local health system to systematically address health risks that leads to maternal and especially neonatal death, which compromise half of the reported infant mortalities. So the DOH really pays attention to this, to really protect po our mother and the child. So si DOH nagpo-provide ng care or nagpo-provide ng mga programs that will really help our mother and child to become healthy, as well as in their nutritional strategy. So there will be reporting in the Department of Health, those yung mga maternal health death and neonatal death. So yan, nagmo-monitor sila, so that maka-create talaga ng implementation of the different policies and actions po sa ating community. So who are these health team facilitators? BEMOC capable facility, so the basic emergency obstetric and newborn care. Provider is capable of private health facility or an appropriately upgraded public health facility that is either a rural health unit and or a satellite barangay health station or hospital capable of performing the following emergency obstetric functions. So ang BEMOC, these are the facilities, either it's in the RHU, ito yung RHU natin, or sa ating barangay health station, or sa mga hospital or may mga primary hospital in a certain community. So there's a parenteral administration, yan, pwede sila makapagbigay ng mga medications such as oxytocin for the third stage of labor. So itong BEMOC, may program din ang Department of Health that will enable or will help our mga nurses, doctors, and midwives. So, ito-train sila ng Department of Health regarding on the care of our mother. So, may mga training na ginagawa po ang ating Department of Health. So, ang una na kaya nilang ma-facilitate o magbigay ng oxytocin on the third stage of our labor. And the second one is the loading dose of our anticonvulsant as well as the mga antibiotics. And also, of course, they will be able to perform deliveries in imminent may mga suhi or mga naka-breech position. And also the removal of our placenta product and the removal of our retained placenta. So those are the things that make sure ng health, these are the composition of our health team facilitators. Sila yung able na makaperform ng mga sinabi natin kanina. So we have also our CEMOC or Capable Facility Comprehensive Health Obstetrics and Newborn Care. So it the provider is a tertiary level regional hospital or medical center, provincial hospital, or appropriate upgraded district hospital. So kung kanina BEMOC yun, there are belong sila sa kanilang mga RHU, ganyan, mga primary. This one is our tertiary hospital. So these are the regional and medical centers. So it can also be capable privately operate medical centers. So capable sila na mag-perform ng emergency such as provides facilities na pinaprovide ng BEMOC. So mga surgical, dito na ginagawa yung ating SEMO. So hindi sila pwede gawin ang mga cesarean section sa RHU. So kaya may SEMOng tayo, yan mga cesarean or tertiary hospital. Diyan ginagawa din po ang ating mga transfusion services and other mga highly obstetric interventions. So mga higher na mga concerns. So they will be catered or facilitated to the higher facility which is our SEMO. So what are the care that is provided in here? It is able to provide emergency to our neonatal, which include the newborn resuscitation, treatment of neonatal sepsis infection, oxygen support, antenatal administration of maternal steroids for threatened premature delivery. So yan yung mga mapapacilitate dapat ng ating SEMOC, no? So ito yung mga pwede nilang ma-perform since they are tertiary hospitals or higher than our BEMOC. So what are the programs? We have this maternal care program. So we have the regular and quality maternal services. So the prenatal care. So as what I have said, prenatal is very important so that they'll be able ma-assess ng maayos po ang ating mga mother all throughout the pregnancy. So yan, nagkakaroon tayo ng complication kasi ang mother mismo hindi nagpupunta sa ating mga RHU or sa mga ating barangay health facilities. So it's very important that to maintain or to have a healthy pregnancy all throughout and also to have a healthy mother and a child, dapat po may prenatal care. Nagbi-visit po regularly ang ating mga mother. And aside from that, the immunization also, the mother is given with tetanus toxoid. So it's their protection since they're exposed to wounds or to the different there is exposure, so may mga wound, no, may mga laceration. So dapat talaga may naka-tetanus toxoid ang ating mother. And also safe delivery care and iron, folate, vitamin A supplementation, which is yan yung nire-reseta ng ating mga doktor sa ating mga mother. And then nursing care after delivery, we have the ENC, that is hemorrhage, laceration, emotional response, and family planning. So, ang maternal and child health nursing ay hindi lang nakafocus during the pregnancy, yan nga after din, like the postpartum hemorrhage or mga laceration, may emotional support. Of course, no, may pinagdadaanin psychologically ang ating mother, and there's a transition from being single and then magkaka-baby na later on, no? So there's a responsibility. And of course, our family planning also should be addressed properly so that there will be a proper gapping and it won't be difficult for the mother and the family to adjust to their in terms of their financial status and also to their setup. Okay. Next is we have also our newborn or child care program. So the government and the Department of Health also implemented different programs such as our ENC, the Unang Yakap. This Unang Yakap will be later on also tackled. No, the Unang will be tackled later by our clinical instructors on the next coming weeks. And then expanded program of immunization, EPI, and the NBS, the newborn hearing screening, infant and young children feeding, breastfeeding, food fortification, and deworming. So sa unang yakap, yun talaga right after delivery, the bond between the mother and the child, and we have this EPI, the different programs. There's the immunization that is accessible to everyone. No, so pwede maka-access in their local communities or in their barangay health center. Itong mga immunization po sa ating mga bakuna sa ating mga bata. And then also the newborn hearing and newborn screening. So it is free during after delivery if you will be giving birth like in the SPMC, yung mga regional hospital. So libre naman yan siya. It is mandatory, it is required that this this procedure will be performed. So that is to prevent further complication if there is may mga abnormalities man later in the newborn screening, and especially also sa ating hearing. So ito is the purpose of this is to assess na ahead of time if there's a problem with the child or the baby. And then of course our infant and young children feeding later, and our breastfeeding of course, no? So breastfeeding is highly recommended. So I am one of the survivor of this exclusive breastfeeding journey for 2 years now. So this one is very fulfilling one, though sometimes difficult, but the difficulty is just a little when you compare it to when you prepare milk for the baby, no? So it's quite more accessible talaga ang ating breastfeeding. And then food fortification also later when the child turns 2, we have this deworming activity. So let's focus now in our prenatal care. So when we talk about prenatal care, it is the health care rendered to a woman from the time of conception until the baby is delivered. So it includes checkups, testing, examination, treatment from the physician, nurses, midwives throughout the pregnancy. So ito, yan, if accessible sila, we have our midwives in our BEMOC, and we have also doctors, no? So dapat talaga ma-assess ang ating mother, ang baby, ang posisyon ng ating baby, tsaka mga testing such as, no, tinetest ng CBC, baka mababa din ang hemoglobin ni mama. So, kailangan din na mabigyan ng supplement. Though, may binibigay din talaga na or may nireseta na mga vitamina ang ating mga OB-GYN. So, yan, dapat talaga ma-test ng maayos ang ating mga mother so that if there's later on na mga complication, ma-prevent po natin yan, no, through these testings and examination. So nowadays, most of the most of the OB-GYNs are requiring this HIV testing, no? So para ma-prevent din ang later complication kasi napapasa ito sa ating baby. So yan, mga testing, may mga examination, no, mga OGTT, mga glucose testing, and mga urinalysis, no, to check if it's their UTI. So that's a common problem kasi ng ating mga mother, as well as our preeclampsia, it may mga protein or albumin ang ating mga ihi, no? So yan din ang yan din ang kahalagahan ng ating prenatal, na-assess na ng maaga ang ating mga magulang, ang ating mga mother. So our objective is to reach all pregnant women to give sufficient care to ensure a healthy pregnancy and the birth of the full-term healthy baby. So yan, para both healthy ang mother at saka ang ating baby. So how often do we visit our OB, our doctor? So for a healthy pregnancy, your doctor will see you on the first weeks natin, 4 to 28, one prenatal visit niyan. So once a month, yan, nag-visit tayo sa ating OB, nagre-reset tayo din siya ng mga vitamins, like iron, folic, ganyan, mga omega that will help the brain development of our baby, no? And also, weeks 28 to 36 prenatal visit every 2 weeks na yan, kasi malapit na yan siyang mga anak, no? So, there's a monitoring. And pagdating ng weeks 36 to 40, dyan na every week na talaga magbivisit si mom. So, intensive na talaga ang monitoring ng ating OB, ang ating mga doctor, ang mga midwives at time, kasi malapit na po mga anak ang ating mama niyan, ang ating mother. Okay? So normal patients following initial evaluation, they will be given healthy instructions and also counseling. So this will include advice for prompt prenatal care examination. So patient with mild complication throughout evaluation of the need of patient with mild complications will determine the frequency of follow-up of these cases by the rural health unit, city health clinic, or periculture clinic. So yan, kung upon the assessment, normal lang talaga ang ating mother, then bibigyan siya ng mga normal healthy change. Healthy change at saka mga counseling, no? So, yan. Pero pag madam, may mga complication ng ating mom, like may gestational diabetes, pre-eclamptic ang ating mother, so yan din nagde-determine ng frequency ng pag-visit niya sa kanilang OB-GYNs or sa hospital or sa kanilang doktor. So yan, dapat talaga ma-determine ahead of time kung ano ang mga concerns, kung may mga problema talaga ang ating mga mothers. Okay? Okay, so let's continue our discussion on prenatal. So lahat ng ating patient that are potentially or they have a potentially serious complication, they should be referred to the most skillful source of medical and hospital care. So they will be referred to tertiary hospitals as their first choice, and later the continuing care will be our second choice, to be followed by our rural health unit or our city health clinic or periculture center. So during the first prenatal visit, it should be made early in pregnancy as possible. So during the first trimester, because it will serve as our baseline, and at the same time, we will be able to identify, or we can identify right immediately what if the patient has complications or what is the existing disease of our client. So more frequent visits should be done for those at risk or with complications. So the risk factors that require more visits. So patients age less than 18 years old and more than 35 years old, high risk of complications. So they have the increased chance of birth defects, and aside from that, also high risk for hemorrhage or bleeding. So those with pre-existing also health problems such as diabetes mellitus, hypertension, asthma, lupus, anemia, and obesity. So they required attention and referral as much as possible if it will take risk na for our baby. Medical problems that develop during pregnancy, we have also our preeclampsia and our gestational diabetes, and also the risk of preterm labor. So those are the risk factors that require more visits. So in taking our obstetric history, we will use the mnemonic GT-PAL. So when we say G, it stands for gravida. It's how many times po nagbuntis ang ating mother. And term, if gestational age for infant that develops 37 to 42 weeks. So full term ang ating baby. Parity, number of times that a woman has given birth to a fetus with gestational age of 24 weeks or more, regardless of whether it was born alive or was stillborn. And abortion, the expulsion of fetus before 20 weeks of viability. So before siya umabot ng kanyang viable age, which is 20 weeks. And L stands for the number of living children. So we have to conduct a comprehensive system of classifying pregnancy, as what we have discussed about GT-PAL, the status of our pregnant mother, and the gestational age birth classification. So preterm, it is less than, when we talk about preterm, before po mag-reach ang ating ang tiyan ng mother 37 or less than 37 weeks. So 37 weeks greater, so it means it's the baby is in full term. So 37 weeks to 39 weeks, we call that early term. And 39 to 41 weeks, we call that full term. And 41 to 42 weeks is a late term. And our post term is greater than 42 weeks. That's post term. We also have, as what we have tackled a while ago, that maternal and child care is a holistic approach. Thus, we have to take note of our health history from the demographic data of our client, the history and the entire status of her health in his surrounding. So we have to take note of our demographic data that includes the name, the ethnicity, the age, the telephone, and the health insurance. And of course, the chief complaint or why the patient her reason for coming to prenatal care. We have to include the last menstrual LMP of our patient, and if there is an exposure to infectious diseases or many may have ingested drugs, those prescribed since a woman thinks that she has been pregnant. So also we have to take note of the family and social profile that includes what is the birthing parents' family composition? Do they have support person? What is their occupation, the source of income, the level of exercise, the hobbies, the substance use, living condition, nutrition, sleep pattern, tobacco and alcohol use also. So it includes our health history, also includes past medical history. So any history, if there is surgery or any diseases such as hypertension, STD or STI, diabetes or allergies, if the patients are all immunized up to date. And of course, our gynecological history. So when was our menarche or our first menstruation? What is the length of menstrual cycle, as well as the flow, if any surgery is related to gynecology. And also, we have to take note of our obstetric, the previous pregnancies, when and the type of outcome of birth, and any history of the previous miscarriages or therapeutic abortion. So we also have to take note of the review of the system. So all the body parts, any diseases, all from the cephalocaudal assessment to our patient. In reviewing the obstetric history, we have to take note also by asking our client the following questions, such as if the pregnancy is intended, or she has any complications, may mga spotting ba, as upon assessment, may mga swelling ba ang hands, ang feet, or any surgery that is being conducted sa kanya. Did she take any medications? May mga medicine ba na tinitake ang ating mother? At nakareceive ba siya ng mga prenatal care? And kailan siya nag-start ng prenatal niya? So, mga duration ng kanyang pagbubuntis o and also ng kanyang labor if naka-experience siya dati, and also if what type of delivery po ang na-experience ng ating mother during her previous pregnancy, and the presentation as well as anesthesia and the stitches, any complications during following birth, may mga bleeding ba, may excessive bleeding or infection, or may the infant's birth weight and sex, hindi ba nag-iyak agad ng baby, ganyan, no? So, yun ang ating special consideration or part of our review of reviewing our pregnancy, review briefly on our pregnancy. So, we have to take note also of our special care such as suctioning, oxygen, or incubation, and was the baby discharged from the healthcare setting with her, and what is the child's present status of it. So those should be questioned or should be assessed now properly during our obstetric history taking. And in our gynecological history, we have to take note of the illnesses in this part. So, yun nga kanina, na-mention natin yung first na menstruation niya, the menarche, ang cycle at saka ang duration, ang tagal, at saka may discomfort ba during this period. And when we talk about gynecological assessment, includes our perineal and breast self-examination, mga past surgery, reproductive planning, at saka sexual history. So in history taking, we have to take note of our EBD. So ating expected date of delivery. So kindly take note of this one. At the end of my discussion, we'll have more activities about this, or we will assess ourselves. No, so when we have to use this one, describe us how far along the pregnancy is. So it is measured in weeks from the first day of the woman's last menstrual cycle to the current. So it's the first day of last menstrual cycle. So we have this Nagel's rule. So when we do this one, you have to subtract 3 in months, add 7 in days, and add 1 in year. So for example, the last menstrual cycle or LMP is September 13, 2020. So we have to subtract po 3, and ang result is 6, and we have to add 7. So the result is 20, and we have to add 1. So our EDD will be June 20, 2021. But there is also a special consideration if it falls to the month, ang LMP po natin na falls sa month ng January, February, or March. Instead, na gamitin natin ang negative -3 plus 7 plus 1, but instead, we will use the +9 plus 7. So you have to utilize this formula. So written with both weeks and days of example, 39 weeks and 0 days. So ganyan po ating pag-compute ng ating LMP using the Nagel's rule. So in gestational age, if the LMP is September 13, 2020, so we have to compute 117 days plus 31, how many days? And the present or current checkup, it's 121. So you have to divide it by 7 equals 17.28 weeks equals 17 weeks and 2 days of age of gestation. So, ganyan po ang ating pag-compute ng ating gestational age. Now, another thing that we have to do, we have to measure the fundal height. So, measuring our fundal height, we have to place the 0 line on the tape on the anterior border of the symphysis pubis and stretch tape over midline of abdomen to top of our fundus. So, the tape should be brought over the curve of the fundus, and the height of the fundus in centimeters equals the number of weeks gestation. So, ganito po, based sa ating picture, ganyan, in a symphysis, sa ating symphysis pubis, no, going up. So, that is how you are going to measure we have to measure our fundal height. So, McDonald's rule, it determines the age of gestation by measuring nga yung ating fundic height from the fundus to the symphysis pubis in centimeters. So, what is our formula? The height of the fundus in centimeter, you have to divide it by 4. Age of gestation in months. So, age in gestation in months should be multiplied by 4, and that is the age of gestation in weeks. So, example is, if 20 centimeters, so, i-divide po natin siya ng 4, equals to 5 months age of gestation. So, si 5 months, i-divide na naman po natin ng 4. So, it was 20 weeks of gestation. So, yan. You have to use this one to convert into weeks, no, from months and weeks. So, pwede natin siyang ma-compute. Also, we can do the other formula, fundic height times 2/7 equals age in months, and fundic height times 8/7, that's the age AOG in weeks. So, our immunization, ang binibigay natin sa ating client na standard is our tetanus toxoid. So, we have TT1 until TT5. So, si tetanus toxoid 1 at first contact or as early as possible in our pregnancy. So, expected na wala pa siyang protection. Pero pag naka-receive na siya ng TT2, meron siyang 1 to 2 years after TT3, 5 years ang kanyang protection, TT4, 10 years, and TT5 is all childbearing years. So, tetanus toxoid for pregnant woman, it protects from tetanus and their newborn infants against neonatal tetanus. That's the purpose of giving our mother this tetanus toxoid. So, neonatal tetanus is one of the public health concerns. So, that is why, importante po na ang pregnant natin na mother at saka childbearing age woman makakuha ng tetanus toxoid immunization para maprotektahan ang deadly or nakakamatay na sakit na ito, yung ating neonatal tetanus. So, a series of 2 doses of TT vaccination must be received by woman 1 month before delivery to protect baby from neonatal tetanus. Yan siya. Kaya siya ginibigay. So, completing the doses, following by recommended. So, based sa recommendation ng ating doktor, ito ay full protection to the mother is so-called fully immunized mother. FIM ang tawag sa kanya, fully immunized mother. And then, during our prenatal visit, one of the standard protocol, kasali talaga no, na i-check ang sa laboratory, ang ihi ng mother, that is for the urinary tract infection, and because it baka may complication later on sa ating baby. So that is why gina-encourage talaga mag-urine test para ma-check po or ma-assess natin kung may urinary tract infection. And aside from that, ma-measure din ang glucose level. So pakita natin no sa ating if positive may sugar doon, may trace ng sugar, it means possible na diabetic ang ating mother. And also, preeclampsia. Kung may protein po, kasi supposedly si protein hindi nagli-leak or lumalabas sa ating ihi. Pero pag may nag-leak na protein sa ihi or that we call that proteinuria, it means possible na hypertensive po ang ating mother or may experiencing preeclampsia. So, we have to check and monitor po ang weight ng ating patient every prenatal. So, kung overweight ba ating mother or underweight na sila. So, kaya importante talaga na upon there's a sign of pregnancy na, the patient should visit right immediately po our clinics or their OB-GYN so that ma-assess po ng maaga kung may baseline talaga kung ilan ang ini-increase ng weight ng ating mother para ma-assess if overweight ba siya or underweight. Now, on by the 20th week na to determine ang fetus presentation, you can have the ultrasound examination. And also, importante talaga na mag-blood typing or RH factor. Kasi ang mother, they are prone to bleeding and possible for mga blood transfusion. No, may mga cesarean at saka nag-hemorrhage. So, kailangan talaga na abunuhan agad ng dugo. Kaya need din siya na mag-blood typing at saka mag-RH factor. And also CBC hemoglobin, that is to check if for anemia kung mababa, no? Kaya nga binibigyan kasi nga dalawa na no, nagsi-share na ng nutrients ang ating mother at saka ang baby. Kaya dapat ma-check kung mataas pa ba ang hemoglobin or anemic na ba ang ating mother. And aside from that, the non-stress test to be done by 28 weeks to determine the fetal heart tone, fetal movement, and uterine contractions. So, we have also genetic screening, hepatitis B, HB SAG, serological test for syphilis and culture for STD, and tuberculosis screening, our Mantoux test. So, we also have to take note and monitor our fetal heartbeat. And we can assess our fetal heartbeat by using or by following our Leopold's maneuver. And also our EFM, through our EFM, electronic fetal monitoring machine, our Doppler unit, and our stethoscope. So these are the materials that will be utilized during the Leopold's maneuver. But don't worry about this. This is one of your return demonstration, and it will be discussed by my fellow clinical instructor, and they will share to you the PRs and everything about our Leopold's maneuver. So our normal fetal heart tone will be 110 to 100 beats per minute. Yan po ang normal. So we have also some other monitors. We have this external fetal monitor. No, ito yung nakikita. No? May naka-attach siya sa machine. And may transducer, no, nagsisense sa ating uterine, kung may uterine contraction po. At ang isa is attached to the fetal heart. So yan, ito ang kanyang image. Nakikita, it looks like yung mga strips na may strip siya, no? So that's the recording of every contractions, no, na napifeel ng ating mother. So yan ang EFM. And we have also our Doppler sound waves to detect the movement of blood in our vessel. So Doppler. Ang sa nutrition naman, ang kaya ng sabi ko kanina, binibigyan ng mga OB-GYN nating mga doktor, ang ating mga pregnant mother ng iron because yun nga nagsishare po ang ating mother, no, and the baby inside her, no? So that is why it should be bigyan talaga po ng mga supplements ang ating mother during pregnancy. And we have folate and folic. So folate is vitamin needed for healthy growth and development. It helps prevent the birth defect. It prevents the defect na tawag natin na neural tube defect, no? Our spina bifida. And aside from that, meron din tayong vitamin A supplementation para po sa ating maternal night vision para ma-develop din po ang organ ng ating baby. And also to boost or maintain our fetal immune system. And aside from that, we encourage our mother na mag-exercise, do walking, yoga, swimming, pallets, mga ganyan, at saka squat. So, monitoring also of our vital signs is necessary. Ang ating mga vital signs, we have the BP, pulse rate, RR, and our temperature. So, during the delivery, it should be clean and safe. So, dapat po clean and safe ang ating delivery. And we have to check for our emergency signs. So, ano po yung mga emergency signs natin? Yun nga, yung isa is our vaginal bleeding. May mga severe abdominal pain, looks very ill, severe headache, with disturbance and severe breathing difficulty, may fever and severe vomiting. So we have to take note all of this and report it right immediately to our physician if we are able to assess with this one. Because yung nga is an emergency case. It's one of the sign of emergency to prevent mortality and morbidity. We really have to address this properly. So we have also statistic related to the measurement of maternal and child health. Later, you will appreciate this one if you'll have your exposure in the community because nga in the Department of Health is taking note, gumagawa po sila ng ganito. They consolidate report from all per region. So, yan yung may mga reporting. That is why the barangay or the health center also is really strict in collecting or assessing this one. So, one of our statistic includes the birth rate, the fertility rate, the fetal death rate, our neonatal death rate, prenatal death rate, our maternal mortality rate, infant mortality rate, childhood mortality rate, and childhood morbidity rate. So these are the things that kindly just recall or scan through it over it, no? If I'll be posting the slides and kindly just run to this one, check this one. No, it's just familiarize the terminology that you'll be encountering later on when you'll have your exposure in the community. Okay. So lastly, pregnancy is going to alter your thinking forever. So it's going to make you realize how fragile important life is and why it must be protected at all costs. So pregnancy is very important. You can realize it's very fragile and it should be protected at all costs. You have to protect both the mother and the child. Okay, at this time, let us elaborate more our nursing or obstetric history. So what are our aims or objectives? So the first one is we will be able to assess or screen those clients who are in the high-risk cases. And also, we have to treat the complications detected early by the examination. And we have to educate our mother by demonstrating the proper way and demonstrating the labor process, and also to ensure continued medical surveillance and prophylaxis. So this aim focuses on the prevention of mortality and morbidity rate of our client. So as early as possible, pag may kinonduct tayo ng mga assessment, ma-prevent yung maternal death and fetal death later. So another thing is to remove the fear about the delivery and to gain confidence before labor, to ensure normal pregnancy with delivery of healthy baby, and also to motivate the couple about to need a family planning. So ang ating maternal and child health nursing, it focuses from the childbearing until the child rearing natin. It's a process. So that is why it doesn't only focus on the labor stage, but also it is a holistic approach. It includes the psychosocial, psychological aspect of our mother and also the next plan of our couples. So in taking our obstetric history, of course, our basic thing that we have to comply or accomplish is to get the general information of our current pregnancy. Diyan papasok yung ating GT-PAL na assessment and also yung ating mga past obstetric history tsaka gynecological. So if the mother experiences before any bleeding during her pregnancy, and of course may mga nag-undergo ba or may mga diagnosis, may mga related problems sa ating gynecological status, no? So that is why it needs to be assessed and recorded. So yung mga past medical history and of course our psychiatric history. Kasi ang psychiatric, as what we have learned, no, they can be transferred or pwede siyang mamana to the next generation. So family history, the social history, ang setup nila, ang types of work, ang types of source of income, and of course ang ating drug history. So kasi pag may mga intake na mga drugs ang ating mga ang mother, so it could affect their newborn or the infant. And also we have allergies and summary, no, and it is included. So for our general information, it includes the name, the age. A woman having her first pregnancy at the age of 30 or above is called, we call that elderly primigravida, while ang extreme naman of age and teenage and elderly are obstetric risk factor. So kung sa extreme na sobrang bata at saka sobrang matanda na ang ating client, so they are at high risk, no? And then the presenting complaints, patient's words, not medical words, or the reason for attending. So yan naman pag may mga chief complaint, it focuses really on what are the subjective information given by the mother. So here in our current pregnancy, yun yung ating sinabi kanina. We have the gravidity, parity, and gestational age, LMP. So we will be using here our Nagel's rule. So si Nagel's rule is we have to add 7 for the first day of LMP and subtract 3 months and add 1 year. So mauna ang ating, so here nauna si ating date, no, plus 7 minus 3 plus 1. So pag there's special consideration, pag January, February, and March, we will be using plus 9 plus 7. So history of current pregnancy. So date as calculated, no, we can assess it by computing or by the computation of our ultrasound. And yan, through ultrasound also makikita doon if it's single or multiple or dalawa ba or twins ba ang nasa loob ng tiyan ng mother. And detailed history of presenting problem and have there any problems, yung mga problems na encounter ng ating mother during her pregnancy, kung may mga bleeding ba, may mga contract, or may mga vaginal losses ba or fluid losses during the process of her pregnancy. So it also include, i-note din po natin when we are taking our history sa ating pregnant mother, if it's first try, second try ba, or third trimester na. So sa ating first trimester, yan yung ating first 12 weeks po. Yan, first 12 weeks. So ano yung mga signs and symptoms that we'll be expecting during the first trimester? So yan, amenorrhea. So there's wala ng menstruation, nag-stop during the reproductive period, and increased frequency of urination. Kasi nga no, nag-enlarge na ang ating lumalaki na si baby, so nako-compress na ang ating bladder. Kaya ihi ang ating mother, no? So during it is between 8 to 11 weeks of gestation. And then nausea and vomiting if severe hyperemesis gravidarum. So minsan nagbibigay ang ating OB-GYN ng or ang ating doktor ng mga medications to treat or to address this nausea and vomiting. Kasi minsan, if it extreme na, excess na, yun nga, hyperemesis gravidarum. So, naglo-lost din, hindi nakakagain ng weight ang ating baby. So, kaya nagbibigay sila ng treatment and that is also, yung treatment naman is hindi yung nakaka-apekto ng ating baby or safe intake. And during our second and third trimester, here, ma-assess natin yung mga fetal movement. So, such as our quickening, which can be observed on the 18 weeks, and also the symptoms of anemia, miscarriage, hyperemesis gravidarum. If with amenorrhea, may mga bleeding or slight bright red, mga painless or dull back pain, and if bleeding first and pain later, so it is suggested to have may abortion na. So yan ang dapat i-assess natin when we are dealing with our client on our second and third trimester. So yan, i-familiarize natin kung ano ang stages and processes na na-encounter ng ating mother from the first to third trimester. So, we have also to assess yung mga painless bleeding natin. We call that placenta previa. So, may mga bleeding, so we have to address it properly. So, pag heavy bleeding, partial expulsion, so baka hindi na siya resembles grapes with nausea and vomiting and cramping, baka hindi siya it's considered a smaller pregnancy. So, mga H small, high the TD4. So, yan, we have also to check that one. And also, we have to take note on the pain unrelated to pregnancy. So, maiba kasi na hindi lang related talaga sa kanyang pagbubuntis, pero kagaya ng itong gastrointestinal. So, normally, minsan talaga nagko-constipate ang ating mga mother due to the iron intake. And minsan, hindi nakaka-ambulate ng maayos ang ating mga mothers. So we have to check also that one, constipation, appendicitis, mga gallstone, cholecystitis, pancreatitis, at saka mga peptic ulceration. Sa ating namang genitourinary, we have cystitis, pyelonephritis, renal stone, and ureteric colic. So those are the diseases that we have to watch out during the pregnancy. And it's not, hindi siya, hindi related, no, na pain. But it causes abdomen pain in that specific system. So we have to watch out also. Baka hindi na dala ng pagbubuntis, pero baka may mga underlying diseases na din ang ating patient. So dapat i-assess po natin ng maayos. And also, dapat i-check din po natin ang preterm or term labor ba siya. May mga placental absorption, mga ligament pain, symphysis fibus dysfunction, preeclampsia. So these are the diseases, no? Ovarian cyst rupture, torsion. So we have also to keep that in mind and watch out of these diseases during our pregnancy. So including in our past obstetric history, we have to list, no, yung ating previous pregnancy. So we can acquire it through the use of our Nagel's rule and outcome in order to address it, ma-address ng maayos. So kung related to multigravida, so how many times na nagbuntis at nanganak ang ating mother, and to be relevant inquiry is to be made whether she had antenatal or internatal care before. So dapat i-assess talaga natin and ask the mother if check up ba ang ating mom, no? So dapat nakapa-check up siya para ma-assess ng maayos or mabigyan ng dapat na ibigay, no? Halimbawa, mga bitamina. So Yan. So, dapat mabigyan ng mga bitamina ang ating mga mother so that healthy din po ang ating baby. So in terms of our gynecological history, we have also to check our periods or the regularity. And also kung may mga contraceptive ba, nakapa-family planning ba, natural family planning, or yung artificial natin na mga contraceptives. And also, kung may mga infections ba in the previous years or in the previous pregnancy. And may mga nakapa-pap smear or cervical smear ba? Or normal delivery ba or cesarean section ang ating mother. So, dapat alam natin. Kasi mostly, pag naka-cesarean na yun siya ng first baby niya, mostly on the second baby, cesarean talaga. Naka-elective na yan siya na cesarean. But then, there are also cases that after cesarean, the first baby was cesarean, and the second one, or the succeeding babies nila is nag-normal delivery na. It is still possible. Possible po yan. So, yan. But then, we have to consider the risk. Baka na-cesarean section siya on the first baby kasi may mga complication siya or mga underlying diseases. So, pag may mga complications or may mga underlying diseases ang mother, so possible, hindi na yan siya pwede normal delivery talaga sa next baby niya. So, that is why we have to take note of our gynecological history. And if there are treatment, mga previous surgery po natin, we have to check yung ating mga past medical and surgical history, as well as our psychiatric. If postpartum blues or depressions, or may mga depressions related to pregnancy, or major psychiatric illnesses talaga na na-encounter ang ating mother. So, yan, postpartum blues, for me, they are normal because I also experienced that one with my first baby. The most important thing when you address the postpartum blues is she needs the social support, no? Kailangan niya ng mga link supports. So such are their family, mga families nila from both side, or most especially po ang ating father or ang husband, no, plays a very important role in the process or after the delivery. Malaki talaga ang role ng ating father, no? Kasi siya ang nag-help to assist the mother in taking care of the baby. So kailangan talaga na ma-address din po natin ng maayos itong mga psychosocial or na-experience ng ating mother para hindi ma-lead into depression and later on major psychiatric illness, no? Para hindi siya mag-worsen. Now, in the family history, we have also to take note because family history, it's a napapasa siya, such as diabetes and hypertension. So yan, so there are also thromboembolic mga diseases, genetic problems, saka psychiatric problems. So this can be acquired. That is why we have to take note of this. Baka later on during the pregnancy, it will exist. So baka mag-manifest yan during pregnancy. So that is why ma-assess na ng maaga ang mother para to prevent complications later on. So, kailangan talaga encourage ang ating mga magulang, especially nandoon sa community, that they have to undergone prenatal para ma-assess ng maayos ang ating mga mothers. So, any history of hereditary illnesses or congenital defect is important. That is required to ensure adequate counseling and screening is offered. So, maagapan at mabigyan ng tamang lunas and mabigyan ng proper diagnosis or mga screening po. At especially, makounsel ng maayos or mabigyan ng health teachings ng maayos ng ating mga magulang. So, previously affected pregnancy with any chromosomal or genetic disorders in maternal side and our multiple gestations. Now, here in our social history, yan, we have also to check, like, nagsasmoke ba si mother, sorry. So, it will really affect the mother, no? The baby, no? Kung mga nicotine, and also, of course, our illegal drug. So, it could lead to defect, magkakaroon ng defect ang ating baby. So, kawawa naman. Kaya dapat, i-educate sila nga na to stop smoking and the use of illegal drugs. And, of course, when we talk about social, it also includes our marital status. So it helps it noting if fertility or fecundity of a woman, and also our occupation. Ang mga occupational hazard. Baka nagtatrabaho ang mother doon sa gasoline station. So nag-inhale na siya ng gas, no? It could cause harm to that is harmful to the baby. So yan mga work ng ating mother. So we have also to address it properly. And also occupation of husband to gives fair idea about the socio-economic status of the patient. So para ma-assess din po natin kung ano talaga ang ano ang status ng kanilang family. And also our drug history and allergies, kasi baka during the pagbigay ng medication sa ating mother, baka mag-cause ng allergies. So dapat alam din po natin ang mga drug history or mga allergies ng ating mother. So included in our social history is the current medications na intake. So minsan, halimbawa ng ating mga current medications, baka asthmatic si mother, and nag-exist ang asthma during the period of pregnancy. So yan, pinapa-use ng PAF or ng seretide PAF, no? So yan, pag we also have to take note of that, the medication taken at any time during pregnancy. If current pregnant, you have to ensure the patient na nag-take siya ng proper vitamins or mga vitamina natin gaya ng folic acid until the 12 weeks of gestation. That is to reduce our spina bifida, and also we have to take note of our allergies and severity. Baka makakos ng anaphylactic shock or rashes. So we're done with our history taking. Let's proceed with our obstetric examination. So sa ating obstetric examination, we have to assess, we have a general exam. That is to take the weight and height and to take the BMI. So these are your baseline data. You have to take this one para ma-assess po if nag-grow ba or tama bang timbang ng ating baby, ng ating mother during the first trimester, second, and third trimester. So, na-assess ng maayos. Kasi pag kulang ang timbang, in-encourage siya, no? Nagbibigay ng additional supplement ang ating mga doktor para ma-intake ng mother, para mabilis din ang pag-grow ni baby. So, yeah, dapat appropriate. Hindi naman na dapat large for gestational age, but it should be appropriate po ang ating timbang ng ating mother during the first trimester and second and third trimester. So yan, at first, yan yung baseline natin. Kailangan talaga natin kunin at saka ating mga vital signs. Of course, to assess, lalo nating blood pressure. Baka pre-eclamptic na ang ating mother, no? Baka hypertensive po ang ating mother. So we have to really assess the following. And cardiovascular examination. So routine auscultation of the maternal fetal heart sounds in asymptomatic women with no cardiac history is unnecessary. So, kung wala namang mga associated cardiovascular diseases, so no need na to do. But if it's symptomatic and we have to check it, we have to really to check po, i-check po dapat natin ang ating mga mother. Or pag may ganyan talaga na case, may existing problem ang ating mother related to cardiovascular, kailangan talaga niya ng clearance when kung lalo na kung cesarean section, so kailangan talaga ng clearance or kailangan talaga ng check-up with the cardiologist. And the sixth one is to have to check our breast. No, we have this breast examination. So our breast examination is formal breast examination is not necessary. Self-examination is as reliable as a general physician examination in detecting our breast masses. So kung ipalpit lang natin po ang ating ipapalpit po ang mga suso ng ating mga mother, no? So mas yan, we have to check if may mga masses ba, form of masses sa surrounding po ng ating breast. And let's proceed with our abdominal exam. So note if any asymmetry, hindi siya ba equal. And of course, we have to look for the fetal movement. So ask about areas of tenderness before the start of examination. And you are going to inspect, so assess the shape of the uterus. Kung may mga asymmetry, look for fetal movement, look for surgical scars, cutaneous signs of pregnancy, like the linea nigra, mga stria gravidarum, stria albicans, ganyan, inverted natin. So ito yon, no? We have also to observe all of this, no? I-assess po natin. It's part of our examination sa ating abdominal exam, and also kung may mga superficial veins na namumuo. Now, let's also palpate. Our aim for palpation is, di ba, during palpation, we use our hands, our fingers, our palm, we will use it to palpate. So, primarily, the focus of this palpation is to check for our fetal parts and mga active fetal movements and the height of our uterus, yung from symphysis to the fundal height, and also our gestational age, and as well as our fetal pulse and fetal light representation. So later on, itong palpation, ma-apply dito ang ating Lippold's maneuver that will be discussed by one of my fellow clinical instructors. So may elaborate po ito ng maayos, and it is Lippold's maneuver is one of your return demonstration for the next week. So ito po yan. And this one, ang pag-assess natin, the symphysis fundal height na appropriate growth is estimated. So yan, itong ginagawa ng doktor, no? Ina-assess niya kung nasa tamang level ba ng growth ang ating baby. So yan, i-encourage ka if hindi pasok sa appropriate ang kanyang age of gestation. So pina-encourage talaga ang mother to take an increase intake healthy foods and like mga proteins, mga healthy foods that will help also the baby to grow inside. And our auscultation, we use it to check for our fetal heart. So dyan na-assess din po natin. So pwede din when you do the Lippold's maneuver, you can also check for our fetal heart tone. And by the use of our stethoscope, and may Doppler ultrasound din po tayo within the 12 weeks. Pag fetal stethoscope, we can utilize it during the 24th weeks of gestation. At ma-assess din po natin if it's breech presentation, kasi it is often heard or above the level of the maternal umbilicus. So, yan, the rate and rhythm of the fetal heart should be determined over 1 minute. So, ito yung ating Doppler ultrasound, and also ito ang ating fetal heart rate monitoring by fetoscope. So, that's the end. Thank you for listening. You can ask your questions later on at the end of this recording. So, thank you very much.